So we're gonna first start by inspecting the scalp. And to do this, you're gonna like move the hair around and you're gonna look underneath on the skin and you're gonna look for any moles or lumps. And you're gonna do this around like the whole head. And any moles or lumps, you wanna do like a complete skin assessment. And then we're gonna go to the skull. The normocephalic skull should be symmetrical, it should be round, and it should be like proportioned to his body. And to do this, we're gonna go from the frontal to the occipital, and then the temporal to the parietal. And an abnormal skull would be depressions, abnormal protrusions, and lumps. And after that, we're going to look at the face, and we want to examine the facial expression first and make sure it's appropriate for behavior. And then after that, we're going to look at the symmetry of the face, and we want to start at the eyebrows, the paparial folds, the nasolabial, the paparial fissures to the nasolabial folds, and then to the corners of his mouth. And then you want to look for any like abnormal facial structures such as exophthalmos, ptosis, edema, or like skin color pigmentation change. And then you're going to want to look for any like involuntary movements such as tics. After that, we're going to go to palpate the temporal artery and the temporomandibular joint. So we're going to first start by palpating the temporal artery, and that's going to be like right here. And then we're going to do the temporomandibular joint as he opens and closes his mouth. So go ahead and open and close your mouth. And it should be like a fluid, like motion that doesn't have any like pain or tenderness or like immobility. Then after that, we're going to go to the sinuses, and we're looking for any like swelling, secretions, hardening, and like thickness. And we're going to start by doing the frontal sinus, which is like right here, and then the maxillary sinus, which is right here. After that, we're going to go to the cranial nerves of the face, which is the trigeminal, and the facial nerve, which is cranial nerve 3 and cranial nerve 5. And we're going to start by doing like the sensations of the face. So I'm going to take like we're going to use a Q-tip in this case, and it can also be a safety pin. So I'm going to have you close your eyes, and I'm going to poke him in like different parts of his face, and you're going to have to tell me if it's like dull or sharp. And you're going to want to like do different sides of the face and compare the sides. So we're going to start with his forehead.
Dull. 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 Dull.
Okay, so we did that. And now we're not going to do it in this scenario, but we would do it in another one. And you take a sterile like cotton whisk, and you touch his cornea, and he should blink. We're not going to do that. And now we're going to go on to lateral jaw movement. So you're going to move your jaw side to side. And any pain, any immobility, tenderness, and it should be like a smooth moment, is it?
Yep.
So after that, we're going to go to his like muscles. So you're going to do the temporal muscle and the masseter muscle as you clench your teeth. So go ahead and clench your teeth. And you want to note the muscle strength of his, like how it feels. So after we did that, we're going to go on to now the facial nerve, and we're going to do a anterior 2/3 of your taste test. So I'm going to put a taste on your tongue, and you're just going to tell me what it tastes like.
Lemon juice.
Yes. And then after this, we're going to look at like his motor functions of his face. So can you puff out your cheeks? Close your eyes. Wrinkle your eyebrows. You can open your eyes. Raise your eyebrows. Smile. Frown. Okay, so after we did that, now we're going to move on to, we're going to look at his like facial, or his head symmetry and his neck. So like sit up really straight. And we're going to make sure like the head is like midline, it's proportional, it's like symmetric, and we're also looking at the like neck to make sure it is also like symmetric and there's like no lumps or like protrusions or like anything like abnormal. And then after that, we're going to assess the range of motion in the spinal cranial nerve, which is cranial nerve 11, which is cranial nerve 11. And to do this, we're first going to start the range of motion. So head right to left, forward, down, and in a circle. And now we're going to test the spinal nerve with like resistance. So we're going to do a shoulder shrug with resistance. So shrug your shoulders. And we're going to test, this is to test the trapezius muscle. And now we're going to do the head. You're going to, so move your head this way. And now move your head this way. And that's to test the sternocleidomastoid muscle. Then after that, we're going to go on to palpate his lymph nodes. So we're going to start with the preauricular lymph node, which is right here. Then we're going to go to the postauricular lymph node, which is back here. Then we're going to go to the occipital lymph node. Then we're going to go to the submental lymph node, the submandibular lymph node, the tonsillar lymph node, the deep cervical chain, and the supraclavicle lymph node. After that, we're going to go on to palpate the trachea. In the trachea, you're going to palpate it. So you're going to sit up straight and look up a little bit. And we're going to palpate the trachea using like 2 fingers. And we're going to go down like this. And it should like be midline. It should be like symmetric on both sides. And then we're going to go to the thyroid. And to do the thyroid, it's really hard to like palpate the thyroid in adults. But first, we're going to have you swallow a sip of water. And now look up before you swallow it. So swallow. Oh. Okay, and now you're going to stay holding on to the water. So now we're going to palpate the trachea. So you can swallow the water again. And we're going to push like our finger like to the side to like feel the trachea and like the cartilage move. So swallow. Okay. And if there's a visible goiter though, you don't want to palpate it. And instead you want to osculate it as the person holds their breath and you're listening for any bruits, which is accelerated blood flow. And then after that's all over, we're going to go on to the carotid pulses. So you're going to take the carotid pulses one side at a time, and we do both sides, but we're not going to in this video. And you're going to note the rhythm, rate, and the equality. So I'm going to palpate it, and I would also do the other side. And then once we're done palpating it, we want to osculate it with the bell of our stethoscope. And when I do this, you're going to hold your breath. So I'm going to start down here. Go ahead and hold your breath. And we would do it for both sides, but we're not for this video. And in this as well, you're listening for any bruits, which is accelerated blood flow. Next, we're going to move to the eyes, and we're going to look at your cranial nerves, cranial nerve 3, 4, and 6, which is your oculomotor, trochlear, and abducens. So we're going to start with the 6 cardinal fields. And we're going to take our pen light, and you're going to look at this, and I'm going to move it in different positions and just follow it with your eyes. Next, we're going to look at his corneal light reflex. So I'm going to shine this light in the brim of his nose, and the light should reflect on both pupils in the same place. So I'm going to go ahead and do that. And they do. Next, we're going to do the cover-uncover test. And we would do this for both eyes, but we're not in this video. So I'm going to cover one eye and stay looking in the distance at an object. And I'm going to hold it there for 10 seconds. And then when I uncover it, the eye's not supposed to move and it's not supposed to deviate. So it didn't, so we're good. Next, I'm gonna look at the external eye structures and like the eyelashes, and abnormalities would be exophthalmos, which is like the bulging of his eyes and like widened papial fissures, and incomplete closure, which can damage the cornea, the corneal damage, and then ptosis, which is like his upper lid is like kind of drooping down, and it like damages, or not damages, it like throws off the symmetry, so there's asymmetry. And then the periorbital edema, which is like the upper and the lower swollen. And then the ectrophin, which is it rolls out, and an entrophin is where it rolls in. So after we did that, we're going to look at the conjunctiva, the sclera, the iris, and the cornea. So the conjunctiva is the part that covers the sclera, the outside of the sclera, and the inside of your upper and your lower eyelids. And your bulbar conjunctiva is like the white part, and then the palpebrial is like the part that's in like the inside. So we're going to examine the palpebrial. So I'm going to pull down his eyelid, and I want you to look up, down, side to side, and you're like looking for any like lumps, lesions. It should be like kind of a reddish pink. It should be moist. And then after that, we're going to move on to the sclera. And the sclera is white, but in darker individuals, it may be more of like a grayish blue color. And it's also like, it's not uncommon to see little like white or little brown spots and like little yellow spots like from fatty deposits. And then we're going to look at his cornea by shining a light across his cornea, and we're looking for like smoothness and clarity. So I'm gonna go ahead and do that. Okay. And then we're gonna look at his iris, and the iris should be round, it should be smooth, it should be even, it should have like the same like color orientation. Then after that, we're gonna go to perla, which is pupils are equal, round, reactive to light, and accommodate. So we're gonna first look at his pupils. And the pupils should be round, they should be the same, they should be smooth, they should be flat. And we're also gonna like measure his pupils, and the like normal size for adults is from 3 to 5 millimeters. So we're gonna look at his pupils. I would say they're like about a 4 on both sides. You wanna do that. And then after that, we're gonna test accommodation. So I'm gonna have you look at my pen light. And then I'm gonna like bring it into your nose, and I just want you to follow it. And his pupils should cross, and they should like, not his pupils, his eyes should cross, and his pupils should constrict. And they do. And now we're also gonna test the pupil light reflex. And to do this, we have to dim the lights. So I want you to stare off at an object, and then I'm going to shine my light into one of your pupils. So when he's staring off into the distance, this is what dilates it, and when I shine a light, it should constrict it. And it does. So we can turn the lights back on. After that, we're going to move on to the ears, and we're going to look at his external ear structures, and it should be like bilateral. There should be no redness, there should be no swelling, there should be no thickening, and the skin color should be the same color as his face. Then we're going to look at the external auditory meatus, and that's like right here. And you want to note the size. So like when you go to your otoscope, you can like figure out like what size you want to put on it. And there should be no redness, swelling, like lesions, and discharge. Some cerumean is like normal, and this can vary from like a greenish color to like a light brown to like a black color, and it can be waxy, it can be moist, it can be dry, and it can be like desiccated. And then we're gonna go look at the pinna, the tragus, and the mastoid process. So we're gonna look at the pinna, and this is your whole auriculae, which is like the whole thing we're looking at too. So we're gonna move the pinna around, we're gonna push on the tragus, and does that have any pain?
No.
So that's good, and it should also feel firm. And then we're gonna palpate the mastoid process. And is there any pain?
Nope.
So that's good too. And then we are going to do the otoscope, and we're gonna look at his tympanic membrane and the external ear canal. The tympanic membrane should be like a glossy, like pearly, like light gray, like light blue color, like a gray light blue, and there should be like no foreign bodies in there. And then we're gonna look at the external ear canal, and you wanna note any redness, swelling, lesions, inflammation. And then the cone of light in the right ear should be 5 o'clock, and the cone of light in the left ear should be 7 o'clock. In a normal exam, we would examine both ears, but in this one, we're not going to. And then since he's an adult, we want to pull his ear up and back, and he's going to lean to the opposite side you're examining. But if it was a kid, you would want to pull the peanut down under 3 years old. We look in his eye or his ear. And then in a normal, you would look longer, but I'm not going to. And now we are going to do we're going to test for acoustic nerve 11. And this is going to be done with the whisper test. So I want you to close this ear, push down on your tragus, and I'm going to stand about 2 feet behind him, and I'm going to whisper a set of 3 letters, and you just repeat the letters you hear back to me.
C, D, E.
Okay, so after the ears, we're going to move on to the nose, mouth, and the throat. So we're going to first look at his nose, and it should be like midline. It should be symmetrical. And then when they first come in, and like when you're palpating it, you don't want to make sure like you press too hard if you think there's like they express any pain or like you think there's pain. And you're also going to look for like swelling and like lesions and lumps and yeah. So we're going to inspect the nasal mucosa and the nasal septum. So we're going to first inspect the nasal mucosa, and it should be like smooth. It should be like a reddish color. You want to note any discharge, and when you do note the discharge, you want to note the color, the odor, the consistency, and the amount. So we're going to do this, and we're going to first do this, and we're going to lift up his nose for both ones, and we're going to like have him sitting like straight, and then we'd also do it with his head tilted back. So we're going to do that. Okay, now tilt your head back. And then we also want to examine his nasal septum, which is right here. And it should be midline. It should like separate the two like nares in like a straight line. And sometimes you'll see like little like curves or like deviations, and like that's okay as long as it's not like limiting airflow. And then we're gonna move on to we're gonna do a sense of smell. So we're gonna do olfactory first, which is cranial nerve 1. So go ahead and close your eyes. And I'm going to wave the scent underneath his nose, and you have to tell me like what it is.
Vanilla.
Yes. And then this was previous, but we're going to go back to that. And we're going to test the patency of your nostrils. So I want you to close one nostril, breathe in. Now close the other one, breathe in. Yes, and that's testing like if there's any like obstruction. So now we're going to move on to the mouth, and we're going to first look at the lips, and you want to make sure there's no like swelling. They should be like this normal pink color. You want to make sure there's like no cracking or like no bleeding or anything. And then we're going to go on to the teeth and the gums, and we're going to look at his teeth, and they should be straight. They should be white. They should be free of debris and decay. And there should be 32 teeth total, 8 on the right, 8 on the left, top and bottom. And so, smile, yes, for inspecting his teeth. And now we're going to move on to his gums. And if he wears dentures, we would have him take it out. And we're gonna look at the gums, and we're gonna pull his lip down and then pull it up, but we're gonna place a glove on our dominant hand. So I'm gonna look at your bottom lips, and I'm gonna look at your top lips, or your gums, and we're gonna know any like super like red, we're gonna know any like bleeding, we're gonna know any inflammation, swelling, like lumps, lesions, anything abnormal. And then we're also gonna palpate his gums, and we're gonna do this to see if there's like any swelling or hypertrophy or any like abnormalities. So we're gonna palpate his gums. Okay, so after we did that, now we're gonna look at his tongue. So we're gonna use our tongue blade, aka our spoon, and our gauze, aka our paper towels. So we're gonna look at his tongue with this. And the tongue should be moist, it should be intact, and it should be like free of lesions. And then we're gonna look at the bottom of his mouth, like the bottom of his mouth. And so like, let me see the bottom of your mouth. Yes. And we're noting like if there's any like cyanosis, pallor, reddening, edema. And then and the bottom of your mouth is like a good place for oral cancer. So then we're gonna look at his buccal mucosa, which is like the sides of like inside of his cheeks. And you wanna make sure to do like both sides, because just one side is good doesn't mean the other side's good. So we're taking our tongue blade again. So we're gonna look at his inside of his cheeks, and they should be, we would do the other side too. They should be moist, smooth, and like kind of a reddish color. And then we wanna look at his anterior hard palate and his posterior soft palate. So look up. So his anterior hard palate right here, and the soft palate's back there. And the anterior hard palate should be like firm. It should be like a white, light pink. And the soft palate should be like more red and like spongy, and it's movable. After that, we're gonna go to his tonsils. And we're gonna look at his tonsils, and like they should have like little crypts or indentations. And that reminds me back to the gums. The gums have like little like dots on them. Sorry, I forgot to say that. And we're gonna grade his tonsils. So go ahead and open up. You're gonna look at it with your light. And 1+ is visible, which his are. 2+ it's halfway like from the tonsils to like the uvula. And then 3+ it's touching the uvula. And 4+ the tonsils are touching each other. After that, we're gonna go to assess the glossopharyngeal and the tragus. The vagus nerve, which is cranial nerve 9 and 10. And to do this, we're gonna do a like taste test again on his posterior 1/3 of tongue, and we're gonna like use different tastes. So you're gonna distinguish the taste that I put on it, and in between you'll have a sip of water. So go ahead and say ah.
Salt.
Yep. So then you can have a taste. Okay, so now we're gonna do it again with this one.
Sugar.
Yep. And then we would also do like a gag reflex test, but we're not going to do that with him. And it's you take your little like tongue blade and you touch the uvula, and they should gag. But we are going to you're going to say ah, and we're going to look at his uvula, and it should like move. So go ahead and say ah. Say ah. And it moves. So then we're going to test the hypoglossal nerve, which is cranial nerve 12. And to do this, so stick out your tongue, move it side to side, and now up to the top of your mouth. And you're just gonna want to like his is, it should be like a smooth movement without any like ticks or tremors or like any unnecessary movement. And that's it. Not 360.
360.
And then top and bottom. Up there
Up there, ceiling,
and bottom.
bottom floor, dog toys. Is that good?